Good morning to you all. Today we are going to revise on the extraocular muscles and lacrimal apparatus. Today we are discussing about the extraocular muscles and lacrimal apparatus. Okay, what are these extraocular muscles? Are nothing but orbital muscles. Okay, orbit consists of two groups of muscles. Those are extrinsic muscle or extraocular muscles, intrinsic muscle or intraocular muscles. What is the main function of the extraocular muscles? Are nothing but extrinsic muscles of the eyeball. What the function for the extrinsic muscles of the eyeball are? These will be helpful in the involvement of the movement of the eyeball, involvement in the movement of the eyeball. Whereas intrinsic muscles helps to control the shape of the lens and size of the pupil. Okay, these are the main functions for the intrinsic and extrinsic muscles of the eyeball. Intrinsic muscles are helpful by movement of the eyeball, whereas intrinsic muscles are helps in controlling the shape of the lens and pupil size. Next, these orbital muscles are divided into two groups. Okay, those are intraocular muscles and extraocular muscles. Those are intraocular muscles and extraocular muscles. Okay, here the important topic here is extraocular muscles. Okay, extraocular muscles. Those are again divided into involuntary muscles and voluntary muscles. Okay, these extraocular muscles are again divided into involuntary muscles and voluntary muscles. What are the voluntary muscles present here in the orbit? Okay, those are 7 in number. Okay, those are 7 in number. Okay, those are, first is a levator palpebrae superioris. Levator palpebrae superioris, whereas superior rectus, inferior rectus, medial rectus, lateral rectus, superior oblique muscle and inferior oblique muscle. All these 7 muscles are involuntary muscles of extraocular muscles of the eyeball. Okay, extraocular muscles of the orbit. Okay, levator palpebrae superioris, superior rectus, inferior rectus muscle, medius rectus muscle, lateral rectus muscle, superior oblique and inferior oblique muscles. Okay, these are all comes under the voluntary control. Okay, whereas involuntary muscles are means those are not under control, in our control. Okay, those muscles are, what are those muscles? Superior tarsal muscle, where it is present? It is present in the upper eyelid, whereas inferior tarsal muscle present in the lower eyelid. Okay, these two are the tarsal muscles, superior tarsal muscle and inferior tarsal muscles. Okay, these are all the muscles of the extraocular muscles. Whereas intraocular muscles means here you are going to see ciliary muscles and pupil, and dilated pupil. All these muscles will come under the intraocular muscles. Okay, here the main topic here is extraocular muscles, involuntary muscles and voluntary muscles. Involuntary muscles are not under control, whereas voluntary muscles are in our control. Okay, voluntary muscles are 7 in number. Those are arranged in groups. Okay, levator palpebrae superioris is one muscle, and all the 4 rectus will come under one group, whereas 2 oblique muscles will come in another group. Okay, next, see here, this is the picture for the rectus muscles and for all the involuntary muscles. Okay, see, this is the levator palpebrae superioris. After removing the roof of the orbit, first you are going to see in the pat of fat, we are going to see this levator palpebrae superioris. Already we had seen in the dissection also. Okay, this is the levator palpebrae superioris. Below that you are going to see that superior oblique muscle. This is the superior oblique muscle. See, this is the superior oblique muscle. And next, this is the superior rectus muscle. Rectus muscles are 4 in number. Okay, superior rectus, inferior rectus, medial rectus and lateral rectus. These two are the lateral rectus. Okay, superior rectus, this is the medial rectus, this is the lateral rectus and this is the inferior rectus muscle. Those are 4 in number. Okay, next, this is the superior oblique muscle and this is the inferior oblique muscle. Okay, this is the inferior oblique muscle. Okay, and next here is levator palpebrae superioris. All together called as 7 muscles. Okay, those are arranged in 3 groups. Levator palpebrae superioris is the superficial muscle. Okay, all these rectus muscles 4 in number, those are superior rectus, medial rectus, lateral rectus, and inferior rectus. Okay, these are arranged in a cone-like manner. Okay, these are arranged in a cone-like manner. Okay. Next, oblique muscles, two muscles, superior oblique muscle and inferior oblique muscle. All these muscles helpful for the movement of the eyeball. Okay, all these muscles are involved in the movement of the eyeballs. Okay, these are the main involuntary muscles. Okay, those are 7 in number. Okay, first we are going to discuss about the levator palpebrae superioris. This is a superficial muscle where it is present. It is present in the roof of the orbit. Okay, it is present in the roof of the orbit. So this is the levator palpebrae superioris. Coming to the origin of this levator palpebrae superioris, it will be gives origin from the under surface of the lesser wing of the sphenoid. Okay, under surface of the or inferior surface of the lesser wing of the sphenoid above the optic canal. Above the optic canal. See, this is the optic canal. Okay, from this optic canal the optic nerve will be passes. Okay, so above the optic canal and under surface or inferior surface of the lesser wing of the sphenoid, it will be gives origin. Okay, and next it will be gets inserted into the skin of the upper eyelid. Okay, it will be gets inserted into the skin of the upper eyelid along with the anterior surface of superior tarsal muscle, or also called as a Muller's muscle. See, this is the superior tarsal plate. Okay, this is the superior tarsal plate muscle. Okay, this is the superior tarsal muscle. It will be gets inserted into the upper surface of the skin. Okay, of the upper eyelid, whereas it will be inserted into the anterior surface of the superior tarsal muscle. Okay, it is also called as a Muller's muscle. Okay, and it will be gets attached into the superior conjunctival fornix. Superior conjunctival fornix. Okay, this is the insertion for the levator palpebrae superioris. Okay, origin is from the under surface of the lesser wing or inferior surface of the lesser wing of the sphenoid and just above the optic canal. Okay, just above the optic canal, it will be gives attachment origin to the levator palpebrae superioris. Okay, and it will be gets inserted into the upper surface, upper skin. Okay, skin of the upper eyelid, skin of the upper eyelid. See, this is the skin of the upper eyelid and anterior surface of the superior tarsal muscle. Okay, and also it will be inserted into the superior conjunctival fornix. Superior conjunctival fornix. This is a superior conjunctival fornix. Okay. Next, nerve supply for this levator palpebrae superioris. It is supplied by the oculomotor nerve. Okay, it is supplied by the superficial branch of the oculomotor nerve. Okay, what is the main actions of this levator palpebrae superioris? Okay, coming to the action, it elevates the upper eyelid. Okay, it will elevates the upper eyelid. Okay, whereas uh, this is the main function here. Okay, which muscle is useful for the elevation of the upper eyelid? Levator palpebrae superioris muscle, which will elevate the upper eyelid. Okay, if there is any injury of the oculomotor nerve, if there is any injury in the oculomotor nerve, which will be leads to the drooping of the upper eyelid. Okay, which will be leads to the drooping of the upper eyelid. Okay, it is nothing but the opening of the eye becomes very narrow. Opening of the eye becomes very narrow. Okay, this condition is called as a apoptosis. Okay, this condition is called as a apoptosis. Apoptosis. Okay, injury to sympathetic fibers. Okay, if there is any injury to sympathetic fiber, leads to a Horner syndrome. Okay, it will be leads to a Horner syndrome. It will in this Horner syndrome, the partial apoptosis leads to a paralysis of Muller's muscle. Okay, here this injury to the sympathetic fiber will be leads to a partial apoptosis due to paralysis of the Muller's. Means is nothing but superior tarsal muscle. Okay, this is the about the levator palpebrae superioris. If there is any injury to the oculomotor nerve, it will be leads to the apoptosis. Okay, is nothing but there is a narrow opening of the eyeball. Okay, there will be. Okay, this is about the levator palpebrae superioris. Okay, next coming to the rectus muscles. Okay, rectus muscles is nothing but straight. Rectus, what is the main meaning of the rectus? In Latin, it's the meaning of the rectus in Latin is straight. Okay, it is nothing but These are four muscles. Okay, rectus muscles are four muscles. Okay, all these muscles will be takes origin from the same place. This is the origin. What is this? Common tendinous ring. Okay, this is a common tendinous ring. It is a connective tissue ring. This connective tissue ring is called as a common tendinous ring. This common tendinous ring is also called as a annulus of Jin. Annulus of Jin. Okay, this is also called as a annulus of Jin. Okay, from this annulus of Jin, all the rectus muscle will takes origin. Okay, according to the name of the rectus muscle, they are attached to the corresponding margins of the annular genome. Okay, it will be attached to the corresponding margin of the fibrous ring. Okay, it will be attached to the corresponding margins of the fibrous ring, or is nothing but common tendinous ring, is also called as an annulus of genome. Okay, annulus of not genome, Jin, annulus of Jin. Okay, okay, this is the superior rectus muscle, and this is the inferior rectus muscle. This is the lateral rectus muscle, and this is the medial rectus muscle. Okay, there are four recti muscles: superior rectus, inferior rectus, whereas lateral rectus and medial rectus. Lateral rectus muscle is having two heads. Okay, it is having two heads. In between these two heads of the lateral rectus muscle, we are going to see adjacent now. Okay, we are going to see the adjacent now in between the two heads of the lateral rectus muscle. Okay, this is the origin of the rectus muscle. All these muscles will be takes origin from the common tendinous ring or fibrous ring or fibrous ring. Okay, it is called as an annulus genome. Okay, it is an important 2 marks question. Okay, it will be gives at this corresponding margins of this fibrous ring will be gives attachment to the rectus muscles. Okay, superior rectus above, inferior rectus below, medial rectus medially, whereas lateral rectus laterally to the fibrous ring. Okay, this is a common ring of connective tissue anterior to the optic foramen. Okay, it will be lies anterior to the optic foramen. Forms a muscle cone, which will be forms a muscle cone. Okay. See, this is the attachments. This is a common tendinous ring. Okay, this is the superior rectus, inferior rectus, medial rectus, and lateral rectus. Okay, what is the origin for the superior rectus muscle? Okay, all the muscles, all the origins of the rectus muscles will be takes from the fibrous ring, or also called as a annulus of Jin. Okay, see the superior limb of the tendinous ring and optic nerve sheath. Okay, optic nerve sheath. It will be takes origin from the common tendinous ring, superior limb of the common tendinous ring, along with the optic nerve sheath. Okay, this optic nerve is covered by a dural sheath. Okay, from this dural sheath also it will be takes origin. Rectus superioris muscle will be takes origin. Okay, all these muscles will be get inserted into the where it will be inserted. All these muscles will be get inserted in front of the equator line of the eyeball. Okay, all these muscles will be get inserted into the in front of the equator line of the eyeball. Okay, behind the sclerocorneal junction. Behind the sclerocorneal junction, it will be inserted. Okay, see insertion to the sclera 7.7 millimeters away from the limbus, obliquely marking angle. Okay, okay, in a sagittal axis. Okay, it is supplied by superior rectus muscle is supplied by lateral muscular artery. It is also a branch of ophthalmic artery. Okay, it is also a branch of the ophthalmic artery. Okay, and now supplied by all these recti muscles are supplied by a third cranial nerve. All these rectus muscles are supplied by third cranial nerve. Okay. Next, coming to the inferior rectus, it also takes origin from the lower limb of the tendinous ring. Okay, lower limb of the annulus of Jin. It will be inserted 6.8 mm away from the limbus. Okay, it will be gets inserted into the 6.8 millimeters away from the limbus. Okay, all these muscles will be get inserted in front of the equator line. Okay, and equator line of the eyeball and behind the sclerocorneal junction. Okay, the main thing here is all this rectus muscle will be gets inserted in front of the equator line. Okay. See, whereas this superior rectus and lateral rectus will be get supplied by lateral muscular artery. Okay, whereas inferior rectus and medial rectus will be supplied by medial muscular artery. These are the main things we are going to read in this rectus muscle. All these muscles will be get originated from the common tendinous ring or annulus subgenum. Okay, according to the corresponding margins of this fibrous ring. Okay, and this will be gets inserted into the behind the sclerocorneal junction. Okay, in front of the equator axis. Okay, in front of the equator axis of the eyeball. Okay, whereas superior rectus and lateral rectus are supplied by lateral muscular artery, whereas inferior rectus and medial rectus are supplied by medial muscular artery. Okay, all these nerves are supplied by third cranial nerve, except lateral rectus. Lateral rectus is supplied by a sixth cranial nerve, is nothing but adjacent nerve. Okay, adjacent nerve. Okay, next coming to the action of the rectus muscle. Action of the rectus muscle. Okay, see, superior rectus muscle will be superior rectus muscle helps in the movement of elevation, intorsion of the eyeball, and adduction of the eyeball. Okay, these are the movements occurred by the superior rectus. Okay, superior elevation of the eyeball, intorsion of the eyeball, whereas adduction of the eyeball will be occurred by the superior rectus, whereas inferior rectus occurred by depression, extorsion, and adduction. Okay, these are the movements occurred by the inferior rectus muscle. Okay, next coming to the medial rectus. Medial rectus is helpful in adduction of the eyeball, whereas lateral rectus is helpful in the abduction of the eyeball. Okay, medial rectus is helpful in adduction, lateral rectus is helpful in abduction of the eyeball. Okay, next coming to the oblique muscles. Okay, these are two in number. Okay, those are superior oblique muscle and inferior oblique muscle. Superior oblique muscle and inferior oblique muscle. Okay, this superior oblique muscle will be takes origin from the inferior surface of the lesser wing of the sphenoid, just below the levator palpebris superioris. It will be also gets origin. Okay, inferior surface of the lesser wing of the sphenoid, and just above the just above and medial to the common tendinous ring. Okay, it's the origin. Physiologically, the origin is into the trochlea, is nothing but it is pulley. It is formed by a superior medial wall of the orbit. Okay, it will be gets inserted into the behind the equatorial line, whereas rectus muscle will be takes insertion in front of the equatorial line, whereas the superior oblique muscles will be get inserted behind the equatorial lines. Okay, in posterior superior quadrant area of the eyeball. Okay, posterior superior quadrant area of the eyeball. Okay, and next, blood supply. It is supplied by the lateral muscular artery. Okay, superior oblique muscle is supplied by fourth cranial nerve. So, okay, whereas superior oblique muscle is supplied by a fourth cranial nerve. Okay, it is nothing but a trochlear nerve. Okay, next coming to the inferior oblique muscle. This inferior oblique muscle also takes origin from the orbital surface of the floor of the maxilla. Orbital surface of the maxilla, just in the floor of the orbit. Okay, it arises from the orbital surface of the maxilla in the floor of the orbit. Okay, it will be inserted into a sclera. All these two superior and inferior oblique muscles will be inserted into the sclera, just behind the sclerocorneal junction. Okay, behind the equatorial line, in the posterior superior quadrant of the eyeball. Okay, this is the origin and insertion of the inferior oblique muscle. Okay, blood supply. It is supplied by a medial muscular artery. Okay, it is supplied by the medial muscular artery. Okay, now it will be supplied by oculomotor nerve, inferior division of the oculomotor nerve. Okay, this is about the inferior oblique muscle. Okay, what is the actions occurred by the superior oblique muscle and inferior oblique muscle? Okay, superior oblique muscle occurs these movements: intorsion of the eyeball, depression of the eyeball, and abduction of the eyeball. Okay, these are the movements occurred by the superior oblique muscle. Whereas this is the inferior oblique muscle. Inferior oblique muscle occurred by extorsion of the eyeball, whereas elevation and abduction of the eyeball. Okay, these are the um, movements occurred by the oblique muscle, superior and inferior oblique muscles. Okay, how the eyeball is divided in three planes. Okay, are also nothing but three axes. Okay, x-axis is nothing but horizontal axis. Okay, x-axis is nothing but horizontal axis. Y-axis is nothing but anterior posterior axis. Y-axis is nothing but anterior posterior axis. Z-axis is nothing but vertical axis. Horizontal axis, anterior posterior axis, and vertical axis. Okay, first we are going to discuss about the horizontal axis. It lies when the head in upright position, when the head is in straight position. Okay, we are talking this horizontal axis. Okay, here the movements occur by the in horizontal axis are elevation and depression of the eyeball. Okay, elevation and depression of the eyeball. Whereas anterior posterior direction, in anterior posterior axis, intorsion movement and extorsion movement. Okay, torsional movements occurs in the anterior posterior axis. Okay, torsional movements are nothing but intorsion movement and extorsion of eyeball. Okay, next coming to the vertical axis. In vertical axis, the movement occur are abduction and adduction movements. Okay, these are occurring z-axis, vertical axis. Okay, these are the three axes. These axes are called as a fixed axis. Okay, fixed axis: horizontal axis, anterior posterior axis, and vertical axis. In horizontal axis, it will be takes place in elevation or in depression. Whereas anterior posterior axis, it takes place, movements takes place are extorsion and intorsion. Whereas in vertical axis, are abduction and adduction of the eyeballs will takes place. Okay. Next, these are the muscles, mean nothing but medial rectus, lateral rectus, superior rectus, inferior rectus, and superior oblique and inferior oblique. Okay, these are the movements occurred by primary action, secondary action, tertiary actions. Okay, these are the muscles produced by the movements in a primary, secondary, tertiary actions. Okay, next coming to the blood supply. All the muscles are supplied by the branches of the ophthalmic artery. Okay, it is divided into medial muscular artery and lateral muscular artery. Medial muscular artery and lateral muscular artery. This medial muscular artery already we had discussed in the recti muscles. Okay, medial muscular artery is supplied to inferior rectus and medial rectus and inferior oblique muscle. Whereas lateral muscular artery supplies all the remaining muscles are nothing but superior rectus, superior oblique, lateral rectus, and levator palpebral superiorus. All these muscles are supplied by medial and lateral muscular branches of ophthalmic artery. Okay. Next, coming to the nerve supply. Okay, what is the nerve supply? All the muscles of the eyeball are supplied by oculomotor nerve, except superior oblique and lateral rectus. Okay, this superior oblique muscle is supplied by a trochlear nerve. Trochlear nerve is nothing but fourth cranial nerve. Okay, whereas lateral rectus is supplied by abducent nerve, is nothing but sixth cranial nerve. Okay, this is the nerve supply of the extraocular muscles. Okay, it is also very important here. Okay, all the muscles of the all the extraocular muscles are supplied by third cranial nerve. It is nothing but oculomotor nerve. Okay, except superior oblique and lateral rectus. Superior oblique is supplied by trochlear nerve and lateral rectus is supplied by abducent nerve. Okay. Next, these are the muscles which occurs the movements. Okay, inferior oblique muscle will be helpful in the lateral and upward lateral movement. Okay, upward lateral movement of the eyeball. Okay, whereas superior oblique muscle will be helpful in lateral downward movement of the eyeball. Okay, inferior oblique for upper lateral movement, whereas in superior oblique for lateral downward movement. Okay, lateral rectus is useful for lateral rotation, whereas medial rectus is useful for medial rotation of the eyeball. Okay, next superior rectus will be helpful in helpful to look medially upwards. It will be superior rectus is helpful to look medially upwards, whereas inferior rectus medially downwards. Okay, it will be looks for the medially downward movement. Okay, these are the movements occurred by these muscles. Okay, if there is any squint or in any strabism, these are the muscles will be tested in these movements. Okay, those are about the extraocular muscles. Those are nearly 7 in number. Okay, these are levator palpebris superioris, superior rectus, inferior rectus, lateral rectus, medial rectus. Totally rectus muscles are 4 in number, whereas in oblique muscles those are 2 in number, superior oblique and inferior oblique muscles. Okay, next coming to the lacrimal apparatus. Okay, lacrimal apparatus. This lacrimal apparatus is useful for the production and drainage of the lacrimal fluid. Lacrimal fluid is nothing but tears. Okay, lacrimal fluid is nothing but tears. Okay, it is concerned with the production and drainage of the lacrimal fluids. Okay, what are the components present in the lacrimal apparatus? Those are lacrimal gland and lacrimal puncta, lacrimal canaliculus, lacrimal sac, and nasolacrimal duct. These are the components of the lacrimal apparatus. Okay, lacrimal gland, lacrimal puncta, next lacrimal canaliculum, lacrimal sac, and nasolacrimal duct. Okay, these are the components here. First, here we are going to discuss about the lacrimal gland. Okay, lacrimal gland is nothing but it is a yellowish, soft, lobulated serous gland. Okay, it is a yellowish, soft, lobulated serous gland. Okay, this lacrimal gland is divided into two parts: upper orbital part and lower palpebral part. See, this is the upper orbital part and this is the lower palpebral part. Okay, where this upper orbital part is lies. It will be lies in the anterolateral part of the roof of the orbit. Okay, anterolateral part of the roof of the orbit. It will be lies in the anterolateral part of the roof of the orbit. Okay, where the lower or palpebral part will be lies. It will be lies in the lateral part of the upper eyelid, where it will be lies in the upper part of the lateral eyelid. Upper eyelid, lateral upper eyelid. Okay, this is the site for the location of the orbital and palpebral part of the lacrimal gland. Lacrimal gland is nothing but it is a yellowish, soft, lobulated. Okay, it is lobulated serous gland. Okay, and next, see this serous gland. Sorry, this lacrimal gland, which will be opens into a conjunctival sac. It usually opens into a conjunctival sac. This is a conjunctival sac through a ducts. Okay, through ducts, this lacrimal fluid will be drained into the conjunctival sac through ducts, lacrimal ducts. These lacrimal ducts are nearly 10 to 12 in number. Okay, these lacrimal ducts are nearly 10 to 12 in number. These ducts which will be opens into the superior conjunctival fornix. These ducts which will be opens into the superior conjunctival fornix. Okay, sometimes there is an accessory lacrimal duct. Where it is present? It is present in the conjunctival fornix of both the eyes. Here it will be present, conjunctival fornix of the both the eyelids. See the structure components of the lacrimal gland. See, this is the lacrimal gland. Okay, two parts of the lacrimal gland, and these are the ducts of the lacrimal gland. This is the conjunctival sac. Okay, this is the conjunctival sac or conjunctival fornix here. Okay, and next this is the site for the puncta. Puncta is nothing but the sac which will be opens into the lacrimal canaliculus. Yeah? Okay, this side is called punctus. Okay, and this is the superior lacrimal canaliculus, and this is the inferior lacrimal canaliculus. This superior and inferior lacrimal canaliculus, which will be opens into a lacrimal sac. This lacrimal sac will be continuous downwards as a nasolacrimal duct. Okay, these are the parts of the lacrimal apparatus, or nothing but these are the components of the lacrimal apparatus. Lacrimal duct, lacrimal gland, lacrimal ducts, conjunctival sac, and next punctus. Okay, and next lacrimal canaliculus. These two are the lacrimal canaliculus, and this is a lacrimal sac and nasolacrimal duct. Okay, and what is the main function here? It will be flushes the lacrimal gland. Okay, this lacrimal gland which will flushes the conjunctival sac and keep the cornea moist and transparent. Okay, functions of the tears. What is the function of the tears? To flush the conjunctival sac and keep the cornea moist and transparent. Okay, it provides nourishment to the cornea. It provides the tears which will be helpful in provide nourishment to the cornea. Okay, and next one can express the emotion without breaking of tears. Without break of tears. Okay, the main thing here is which will be helpful for provide nourishment to the cornea and keep the conjunctival cornea in moist and transparent. Okay, those are the two important functions. Okay, next coming to the conjunctival sac, where the conjunctival sac is present. The conjunctival sac is nothing but it is a potential space. Okay, it is a potential space present between the upper eyelid, between the eyelids and eyeball. See, this is the eyeball and these are the eyelids. This potential space between the eyeball and eyelids is called as a conjunctival sac. Okay, this is the conjunctival sac. Okay, conjunctival sac is nothing but it is a potential space between the eyelids and eyeball. Okay, next coming to the conjunctival fornix. Okay, conjunctival fornix is nothing but a line reflection between the bulbar and palpebral conjunctiva, where the bulbar conjunctiva which will be reflects onto the palpebral conjunctiva. Okay, this is called as a fornix, conjunctival fornix. Okay, next coming to the lacrimal canaliculus. These two are the lacrimal canaliculus. Those are two in number. Okay, it will be measures nearly 10 millimeters in length. It will be measures nearly 10 millimeters in length. Okay, it has superior canaliculi and inferior canaliculi. Superior canaliculi, from where it will be begins. It will be begins from the lacrimal puncta. Here, this is the site for the lacrimal puncta. Okay, which will be passes upwards and then downwards medially, which will be opens into the lacrimal sac. Okay, which will be opens into the lacrimal sac. Okay, this is about the superior canaliculi. How it will be passes? It will be arises. It will be begins from the puncta, which will be passes upwards and then downwards medially, which will be opens into the lacrimal sac. Okay, this is nearly 10 millimeters in length. Okay, next coming to the inferior canaliculi. It will also begins from the lower puncta, lacrimal puncta. Okay, this will be passes downwards and then horizontally, medially upwards. Okay, and then horizontally, medially towards the lacrimal sac. Okay, it will also opens into the lacrimal sac. Okay, okay. At the bending of each canaliculi, where the canaliculus will be bends upwards and downwards. The junction between the upwards and then downwards medially. Here there is a ampulla. There is a small dilatation is called as a ampulla. Okay, is present. Next, coming to the lacrimal sac. This lacrimal sac, this is the lacrimal sac. It is nothing but where you are going to see the lacrimal sac. This is the lacrimal sac. Blind end, blind or blunt end of the nasolacrimal duct is called as a upper blunt end of the nasolacrimal duct is called as a lacrimal sac. Okay, it is nearly 12 millimeters in length. It is nearly 12 millimeters in length. Okay, where it is present? It is present in the lacrimal fossa. It is present in the lacrimal fossa. How this lacrimal fossa is formed? By a frontal process of maxilla and lacrimal bone. Okay, this is the site for the lacrimal fossa. Okay, where you are going to see this? It is formed by frontal process of the maxilla bone and lacrimal bones. Okay, coming to the boundaries of the lacrimal sac. Okay, in front it will be related with, or anteriorly it will be related with the medial palpebral ligament. Okay, behind it will be related with the lacrimal part of the orbicularis oculi muscle. Okay, behind it will be related with the lacrimal part of the orbicularis oculi muscle. Okay, whereas medially it will be related with the arterial plexus. Okay, these arterial plexus are formed by the facial artery, terminal branches of the facial artery. Okay, which will be uh, separated from the bony fossa, whereas laterally it will be related with the lacrimal fascia. Okay, these are the relations, these are the boundaries for the lacrimal sac. In front by the medial palpebral ligament, behind by the lacrimal part of orbicularis oculi muscle, whereas laterally by the lacrimal fascia, and medially by the arterial plexus of facial artery, separated from this lacrimal bony fossa. Okay, this is about the lacrimal sac. Lacrimal sac is nothing but upper blind end of the nasolacrimal duct is called as a lacrimal sac. Okay, it is nearly 12 millimeters in length. It will be continuous downwards as a nasolacrimal duct. See, this is the lacrimal sac. Okay, next lacrimal duct. Okay, it is a membranous canal, measures nearly 18 millimeters in length. It will be measures nearly 18 millimeters in length. Okay, it will be begins from the lower end of the lacrimal sac. It will be begins from the lower end of the lacrimal sac. Okay, and runs downwards and opens into the inferior meatus of the nose. Okay, it will be opens into the inferior meatus of the nose. Okay, the duct is narrow in the middle and wide in the above on both ends. Okay, the duct is narrow in the middle and wide at upper and lower ends. Okay, the lower opening, see here, the lower opening is guarded by a valve of Husner's. Okay, here you are in the lower end opening. Here you are going to see a valve. This valve is called as a Husner's valve. Okay, this Husner's valve which will prevents the air being blowing up to the duct into the eyeball. Okay, it will be prevents the air blowing, okay, to up of the duct of the eyeball. Okay, see, if there is any inflammation of the lacrimal sac due to obstruction of the nasolacrimal duct, leads to retention of mucus and tears in this sac. Okay, in this sac, it is called as a dacryocystitis. Okay, next, coming to the blood supply of the lacrimal gland is supplied by lacrimal artery. It is also a branch of the ophthalmic artery. Okay, it is a branch of the ophthalmic artery. The veins which will be drains into the ophthalmic vein. Okay, the lymph nodes which will be drains into the preauricular lymph nodes. Okay, blood supply by the lacrimal artery, which is a branch of the ophthalmic artery. And next, venous drainage which will be drains into a ophthalmic vein. Okay, and next, lymphatic drainage which will be drains into the preauricular lymph nodes, which will be drains into the preauricular lymph nodes. Okay, next, parasympathetic supply which will be supplied by lacrimal nuclei of facial nerve. Okay, lacrimal nuclei of the facial nerve. Okay, and next, sympathetic supply is by carotid plexus. Sympathetic supply is by carotid plexus. Okay, sensory supply by lacrimal nerve. Okay, lacrimal nerve, it is nothing but a branch of the ophthalmic division of trigeminal nerve. Okay. Next, coming to the applied anatomy of the lacrimal apparatus. Already we have seen dry eye. Okay, it is also called as a keratinoconjunctivitis sicca. Okay, it is nothing but KCS. KCS is nothing but keratoconjunctivitis sicca. Okay, it is nothing but dry eye. Eye will be in dry condition. Okay, why it will be dry? Due to lack of lacrimal gland deficiency. Due to lacrimal gland deficiency or obstruction of the lacrimal ducts. Okay. Next, hyperlacrimation. Hyperlacrimation due to tumor or cyst of the lacrimal gland. Okay, causes effects of strong parasympathetic drugs. Okay, and next, epiphora is due to pumping failure or obstruction of the gland. Okay, and next, uh, dichoriocystitis. Okay, already we had seen in the previous slides due to the blockage of or infection of the nasolacrimal sac. Okay, this is about the extraocular muscles and lacrimal apparatus. Okay, thank you.